Good morning, everybody. I'm Russ Rader, Senior Vice President of Communications for the Insurance Institute for Highway Safety. And on behalf of the Lifesavers Planning Committee, I would like to welcome you to the 39th Annual Lifesavers National Conference on Highway Safety Priorities virtually. I'm honored to serve as the MC for today's opening plenary session. If you're not familiar with the Insurance Institute, you've probably seen our crash tests of new vehicles on TV. IIHS is wholly funded by the auto insurance industry in the US and Canada with the mission of reducing the deaths, injuries, and property damage that result from motor vehicle crashes. But we don't just crash test new cars. Our research covers all angles of traffic safety, including looking at the best ways to protect not only motorists, but also pedestrians, bicyclists, and motorcycle riders. You may not know this, but our first president was Dr. William Haddon, who also served as the first federal highway chief at the agency that was to become the National Highway Traffic Safety Administration. And Dr. Haddon recognized that motor vehicle deaths are not random accidents, but rather predictable events, crashes that could be prevented with the right mix of interventions. And that philosophy is one of the reasons we are here today. Obviously, as our meeting begins, things are quite different this year than at past conferences. The COVID-19 pandemic has posed many challenges for traffic safety professionals, law enforcement, public health workers, and of course, the healthcare professionals who are tirelessly and selflessly working to save lives amidst this crisis. And we applaud you. We have certainly endured tragedies as a global community over the past year. And let us pause for a moment of silence now for those that we have lost this year to the pandemic. And we hope that you and your families are all safe and healthy. And our thoughts go out to those who have struggled and are currently struggling as a result of COVID. As much as we would all love to be attending in person, we are happy to be able to bring to you virtually over 70 workshops, several networking opportunities, an exhibit hall featuring the latest and greatest in highway safety today, and new this year, peer exchange sessions, all on this virtual platform. And we are also offering daily prizes this year. Make sure to click on the giveaways icon on the bottom right area of the navigation bar to join in the fun. So that's an added benefit this year that'll be a lot of fun. You know, as tragic as the COVID pandemic has been for so many, it has provided opportunities for several families, many families, to spend more time together. Most of us have been telecommuting or working from home this year. Additionally, most parents have been adapting to in-home schooling with their children, and this has become the norm in 2020 and continues into 2021. Many have taken this time to appreciate their family more and spend time otherwise than in the office and commuting, and also interacting more with their children and even their pets too. And most parents are not aware that car crashes are the #1 cause of deaths to children in the United States. And throughout the world, hundreds of thousands of children die of a car crash injury every year, and nearly every one of those tragedies is preventable. We know the proper use of child restraints in a vehicle is so important. And we also still face the challenge of children not getting buckled in at all. But we can celebrate a lot of progress in this area thanks to all of you. And I would like to take this opportunity to recognize those who have demonstrated exemplary service to help protect our children in the event of a crash. We are pleased to announce the 2021 National Child Passenger Safety Award winners. And first, Bailey Bacuris of Texas has been named Child Passenger Safety Technician of the Year. Ms. Bacuris is recognized for filling a void and connecting with caregivers during the pandemic. Sydney Bradley of Vermont has been selected as the Child Passenger Safety Instructor of the Year. Mr. Bradley has made it his mission to support child passenger safety education and has ensured that 94% of residential buildings in Vermont are within a 30-minute drive of a public car seat inspection site, which are predominantly staffed by volunteers. Janet Tan of Malaysia has been named the Child Passenger Safety International Instructor of the Year. Ms. Tan, her determination to shift a culture has led to the passage of child passenger safety regulations in Malaysia, and there are now 77 CPS technicians trained in Malaysia as a result of her efforts. Last but not least, Northern New Jersey Safe Kids, Safe Communities has been named Team of the Year. During the pandemic, this team found safety solutions by tapping into a creative thinking mindset, offering virtual car seat checks by appointment, and implementing new child passenger safety training program to reach underserved populations. Please join me in congratulating this year's child passenger safety honorees in a virtual round of applause. More information about each of these winners and their accomplishments will be shared during the session later today, called Mission Critical: Tools for the Future of Child Passenger Safety. And for those attendees who are currently child passenger safety technicians and instructors, thank you for your passion and commitment to helping families keep their children safe on the road. Thank you all. The Lifesavers Conference is a nonprofit entity that would not happen without the support of sponsors and exhibitors. This year, sponsorships allowed Lifesavers to offer low-cost registration fees and attendee scholarships for those that otherwise would not be able to attend, and to share their research or successful traffic safety programs with their peers. Our sponsors are displayed throughout this virtual platform, and Lifesavers thanks these businesses and organizations for their support and commitment to saving lives. Please visit our sponsors and exhibitors in the virtual exhibit hall today from 4 o'clock to 6 o'clock p.m., tomorrow from 11:30 a.m. to 1:30 p.m., and Wednesday from 11:30 a.m. to 1:30 p.m. Eastern Time. Remember, the more sponsors and exhibitors you virtually engage with, the more chances you have to win a daily prize and have some fun with your overall virtual experience. There will also be opportunities to attend post-conference sessions with 3 of our sponsors. So be sure to check out the Lifesavers website and conference program for more information. And isn't it great to be virtually in California in March? I can feel the sea breeze right now. California has been a leader in highway safety, implementing innovative programs and strategies that have led the way nationally. And they have taken the torch to guide us through this year's first ever virtual Lifesavers Conference. And here to officially welcome us to the Golden State is Barbara Rooney, Director of the California Office of Traffic Safety.
Thank you, Russ. California is thrilled to be hosting the virtual Lifesavers Conference this year. Of course, we wish we would have been all together in sunny Long Beach, but grateful for the opportunity to come together as a traffic safety community in this virtual environment. Thank you also for noting, Russ, California is a recognized leader in road safety, and that's because we prioritize safety. We believe that even one death on our roadways is just one too many, and we work at tackling our worst traffic safety issues with a sense of urgency while also seeking out new and innovative strategies to be used to further realize our goal of zero roadway deaths. Now, this sense of urgency and priority around safety was most evident in the summer of 2020 when our state transportation leaders recognized that a bolder and more focused approach was needed to combat the rise in fatalities and serious injuries that were occurring on California roadways. This led us to make several changes to our state highway safety plan, wherein we incorporated additional guiding principles and placed focus on high priority challenge areas. We further expanded the voices and the perspectives being brought to the table in our discussions. Now, our guiding principles have changed, and they now also integrate equity to address institutional and systemic biases. They double down on what works by implementing proven countermeasures that are effective in reducing fatalities. Accelerate advanced technology by forming new partnerships with technology providers, health and safety groups, manufacturers, and government partners to prioritize safety. And implement a safe system approach, requiring us all to have a holistic view of our roadway system. Now, surely you're all participating here today because you know that every one of us can make a difference in the lives of our state's roadway users and contribute to the health and economic vitality of our states. So, welcome and enjoy Lifesavers 2021. I now have the pleasure of introducing a true champion for transportation safety in California, the Secretary of the California State Transportation Agency, David Kim. Governor Newsom appointed David Kim to this role in 2019, which includes oversight of 8 departments, boards, and commissions, including my office, the Office of Traffic Safety, the California Highway Patrol, Caltrans, and the Department of Motor Vehicles. The mission of these departments is to advance a safe, environmentally sustainable transportation system that maximizes mobility for all Californians. Secretary Kim has served at the state, local, and federal level, as well as most recently serving as Vice President of Government Affairs for Hyundai Motor Company. Before Hyundai, Secretary Kim spent nearly 8 years in senior roles at the U.S. Department of Transportation, including as Deputy Administrator of the Federal Highway Administration. He also led government affairs at the Los Angeles County Metropolitan Transportation Authority and previously served in the administration of Governor Gray Davis and in the Office of the U.S. Trade Representative. Finally, Secretary Kim served on the staff of numerous elected officials in Los Angeles, Sacramento, and Washington for a decade. He is a native of Davis, California, and earned his degrees from Occidental College and the University of Southern California. I have had the pleasure of working with Secretary Kim for over the past 2 years. And to borrow from the Secretary's own words, transportation systems are about people and improving their quality of life. Because of this, he has approached tackling the issue of traffic fatalities and serious injuries on California roadways with urgency and focus. And he knows that this requires a collaborative effort that extends well beyond the activities of his departments. Thank you, and here is Secretary David Kim.
On behalf of Governor Gavin Newsom and the great state of California, welcome to the 2021 Lifesavers Conference. I want to thank the Lifesavers Planning Committee, along with Barbara Rooney, Director of the California Office of Traffic Safety, and her staff for their tremendous work in making this conference possible. Also, the City of Long Beach had graciously offered to host this conference as an in-person gathering before the pandemic. Thankfully, the Planning Committee was able to switch gears and organize an incredible virtual conference. But I do hope all of you will have a chance to visit Long Beach once it is safe for you to do so. Here we're expecting 1,500 attendees. That is incredible, and it really shows the dedication of highway safety professionals when it comes to advancing the cause of transportation safety. And it is our hope that you, our nation's highway safety professionals, will take full advantage of this conference to share innovative ideas, compare notes, and learn from one another. I think we can all agree that we have our work cut out for us. It's pretty clear based on recent trends that far too many people continue to die or are seriously injured on our roadways every day. And we all know the numbers. More than 36,000 traffic deaths occurred in 2019. And last year, even with traffic volumes much lower than usual as a result of the pandemic, there were more than 16,000 fatalities in the first half of the year. It's also troubling that preliminary data from the Governor's Highway Safety Administration shows that the national pedestrian fatality rate rose 20% in the first 6 months of 2020. And there's a correlation between these numbers and the notable increase in dangerous driving behaviors. Nearly 3,000 pedestrians were killed by motor vehicles during this period, and this just goes to show how risky it is to walk. That's why we need to redouble our focus on safety for bicyclists and pedestrians. We've got to move the ball forward on safer bike lanes, safer sidewalk designs, and access points, because these are the kinds of improvements that will not only prevent needless deaths and injuries, they also improve quality of life in our communities and create much needed travel options for our residents. On top of that, there are still too many impaired drivers. We need to continue educational and enforcement efforts aimed at sharing the road, buckling up, increasing awareness of the effects of drugs and alcohol on driving, and driving distraction-free. All of these areas are critically important. And to those of you who work in emergency medical services, when a life is on the line, you need time and a clear path. And I'm glad to say that California continues to invest more than $5 billion a year in maintaining and repairing our highways, as well as local streets and roads, investing in critical infrastructure, especially to maintain state of good repair, must continue for public safety. We also need to keep a close eye on emerging technologies that have the promise of enhancing driver and pedestrian safety and expanding mobility options. Accelerating technological advancements and also being willing to try new and innovative approaches should be a part of any roadway safety strategy. I'm really glad that over the next couple of days, you'll have an opportunity to hear from a wide range of professionals who will share what works, as well as other actions we can take to improve transportation safety. And everything we do around the 5 E's, education, engineering, enforcement, emergency response, and emerging technologies, all of these efforts give us hope that we can forge new partnerships, find innovative solutions, and continue with proven countermeasures that will move us closer to our shared goal of eliminating fatalities and injuries on our roadways. As Director Barbara Rooney noted, I'm fond of saying that transportation systems are about people and improving their quality of life. And if we truly want to enhance quality of life, we need to make sure that transportation and traffic safety programs are designed and delivered in a way that will provide equitable and safe access for transportation options. Everyone has the right to travel safely on our roads, regardless of race, socioeconomic status, gender, age, ability, or geographic location. It's important for all of us to develop programs with an eye on improving safety for all groups, especially our most vulnerable and traditionally underserved communities. I also think that we will not be able to move the needle by doing the same thing and expecting different results. So in working together, I think every one of us can make a difference in the lives of all road users and at the same time contribute to the health and economic vitality of our states and nation. I hope this conference deepens your understanding of effective ways to increase traffic safety, and I hope you'll also gain new tools, ideas, and partnerships. You are the innovators, practitioners, and experts who will lead us to a better future when it comes to traffic safety. If we are going to transform the world of safety and reduce fatalities and serious injuries, this group right here, all of you, will lay the groundwork and be the catalyst for change to move us toward zero traffic-related fatalities and serious injuries. So with that, thank you for your dedication. Thank you for your participation. Welcome to Lifesavers 2021. And as we say in California, go safely.
Thank you, Secretary Kim and Governor Newsom, for being with us this morning. Barbara, we appreciate all the time and effort you and your staff as the state host have committed to making this year's Lifesavers Conference a success. Along with the pandemic, 2020 brought several current social issues to light, changing the landscape of traffic safety. California, along with every state, has been faced with identifying strategies to overcome these challenges regarding efforts to make our roadways safe for all users. As traffic safety professionals, we are always looking for ways to reduce crashes, prevent injuries and fatalities on our roads. And we measure this by comparing these numbers year to year and looking and hoping for downward trends. The National Highway Traffic Safety Administration and the National Safety Council report that early estimates from 2020 indicate that the pandemic has influenced driving behaviors in 2020. Although a decline in vehicle miles traveled occurred, there has been a rise in crashes as risky driving behaviors were found to have increased during this time. In particular, lack of belt use, impaired driving, and speeding. The COVID pandemic and current social issues certainly have and continue to impact policing, public health workers, traffic safety professionals, and all road users. It is abundantly clear that we need to double down on the strategies that we know work to reduce the rising number of crashes, reduce risky driving behaviors, and keep everyone safer on the roads. We are honored to have this esteemed panel of subject matter experts today to discuss these challenges to public safety and public health and provide insight regarding strategies to reverse these trends, to go in the right direction toward where we all want to go, to zero. This is the theme throughout our conference this year, to share our experiences regarding the impacts we have faced and our strategies to overcome the challenges these issues have presented. First, you will hear from Lorraine Martin. Lorraine is the president and CEO of the National Safety Council, America's leading nonprofit safety advocate with a century-long legacy of eliminating preventable deaths and injuries from the workplace to any place. Safety has been a guiding value throughout Martin's 35-year career, beginning as an officer in the US Air Force. And from there, Martin deepened her aerospace expertise as an executive at Lockheed Martin, where she led the largest defense aircraft program in history, the F-35 Lightning II stealth fighter. So please, everyone, welcome Lorraine Martin.
Well, Russ, thank you so much for having us here today. I'm really happy to be able to discuss the important topic here today of roadway safety, and as you said, in the time of COVID. If I could, though, I'd like to begin just a little bit on what is the National Safety Council. I know a lot of you attending today probably have some awareness of us, but just to give you sort of the top of that wave tops, as you talked about the ocean behind you there, Russ. We are America's leading nonprofit safety advocate. We were established in 1913 with the charter and then chartered by the US Congress for the sole purpose of saving lives and preventing injuries, really from the workplace to any place. And when we think of that any place, that absolutely includes our roadways. And we have a long and proud history of addressing the most pressing issues in these areas. Two areas that I'd like to sort of cite as examples in our roadway related activities is first our pioneering of defensive driving courses. And in 1964, we pioneered a course to help folks change their behavior on the roadway. And since then, we've trained over 75 million drivers to help make themselves safe and those around them safe. As many of you know, we also lead what's called the Road to Zero Coalition. And I know there's probably some proud members here in the attendance today, so thank you for that. But that coalition has a single goal of eliminating roadway fatalities by 2050. And I'll give you a little bit more on that in just a moment. Today's conversation, though, is very well timed. We're actually losing ground as a nation when it comes to roadway safety. And Russ just highlighted some of that. Though the final data won't be out until December, it usually takes us a little bit of time to really refine our preliminary estimates. Those estimates show a very disturbing trend. And despite a sharp drop in the miles driven in the year of 2020, due to everyone being quarantined or on lockdown, whatever we want to call it, fatalities were up significantly. In other words, the pandemic made our roads deadlier. NSC estimates show that roadway fatalities soared to over 42,000 lives lost in 2020. And this is the highest number of roadway deaths in 13 years. We've been making some good progress, and 13 years of that progress has just been put behind us. To put that in perspective, on a typical day in 2020, 115 loved ones lost their lives. And a year where so many had stresses and lost family members due to COVID. This number truly is alarming, but the death rate, the number of deaths per miles driven, is even more troubling. The US experienced an estimated 24% increase in the rate of deaths per 100 million vehicle miles driven on our roadways last year. And tragically, that's the highest year over year. As Russ said, that's how we estimate roadway related statistics. Year over year, that's the highest increase we've reported at the National Safety Council since we began calculating roadway related statistics in 1924. While we don't have all of the data finalized yet, I do suspect that many of the disturbing trends that we see around traffic fatalities, disparities among race, age, and gender will also have continued in 2020. We had hoped that there'd be a silver lining to the COVID-19, and it would decrease the number of lives lost on our roads as people stayed home and traveled less. Instead, what we even saw was more heartbreaking than we could have imagined. But the million-dollar question is why, and what can we do about it? Why were crashes and deaths so high? In short, it's too early to ascertain specific causation, but all of the folks here at the event today, we know anecdotally and with data in past years that people were more inclined to speed, drive impaired, drive recklessly, and drive distracted than last year. When our roads were empty last year, we saw riskier behavior. We know what results in roadway crashes. And unfortunately, a lot of those behaviors, I'm sure the data is going to show us that that's what happened on our roadways. It's also fitting, though, that we have this discussion right now because this is Distracted Driving Awareness Month. So thank you for helping us to celebrate that and to make sure we put our focus on distracted driving. Further, our roadway safety systems, the ones that are around us as we either walk, drive, or bike, they truly aren't designed to effectively enough to ensure that the errors that will happen, because we're all human, don't cause fatalities and injuries. All of us know, and we all need to support things that we have to do to make a change here. Lawmakers, automakers, all of the driving public, we have to stand up and say enough is enough. NSC believes that every single crash and the resulting death is preventable, and that's why we're taking action. I have the honor to serve as the chair of the Road to Zero Coalition, which I mentioned up front, and we're in the midst of a campaign to urge President Biden and the Transportation Secretary Buttigieg to commit to our shared goal of zero traffic deaths by 2050. We all know someone who was personally impacted by the tragedy on our roadways. Even now, our president. President Biden often speaks about losing his first wife and daughter in a crash in 1972 and the grief that followed. There are so many in our community who have experienced that same grief. Over 1,700 people and organizations, though, have joined our call and counting, maybe you'll join here today, to continue to lead the effort to have safer streets. And if you haven't signed on already to our zerotrafficdeaths.org letter, I ask you to please consider doing so. Join the conversation using hashtag #ZeroTrafficDeaths. I know we can all make a difference. We can get to zero on our roadways. It will take, as Russ said, doubling down on the things that we know that work, accelerating and adopting technology and developments that truly can save lives, and implementing safe systems approach. I look forward to the discussion with the other panelists. And with that, I'll turn it back over to you, Russ.
Well, thank you, Lorraine. Emptier roads and riskier driving was certainly the traffic safety headline of 2020. Next, I'd like to welcome Dr. Federico Vaca, who is the professor and vice chair director of the Yale Drive Sim Lab, Department of Emergency Medicine, Yale School of Medicine. And Dr. Vaca is a practicing and board certified emergency medicine physician and physician scientist. Prior to his current position at Yale, Dr. Vaca served as a medical fellow for the U.S. Department of Transportation's National Highway Traffic Safety Administration in Washington. And over the last 20 years, his research has focused on occupant safety, adolescent development and behaviors that influence the risk of motor vehicle crash morbidity and mortality, as well as health disparities in injury and alcohol use disorders. His research has been funded federally by the Eunice Kennedy Shriver National Institute of Child Health and Human Development, NIH's Office of Behavioral and Social Science, and the National Institute of Alcohol Abuse and Alcoholism. Dr. Vaca serves on 2 standing committees of the National Academies of Sciences, Engineering, and Medicine's Transportation Research Board, one focused on road user measurement and evaluation, and the other on vehicle user education, training, and licensing. So please welcome Dr. Vaca.
Thank you very much, Russ. Truly appreciate the introduction, and I'm really honored to be able to be here with everybody today. Thank you for the invitation. What I'd like to do today is, in a few minutes, just briefly reflect on this year of COVID for us from a clinical perspective as well as a traffic safety perspective. But before I even get there, as you heard a little bit about my background, I'd have to say that my pathway in traffic safety was certainly carved out for me long before I got to where I am now. And I thank God for my parents. I was born in Panama. My father was an auto mechanic. My mother was a medical surgical nurse. And my father put us in about, would have been about 1967, 1968, put us in a Chevy Corvair, drove about 4,200 miles from Panama City to the Bay Area, California. And we started our life in California. And here I am now as an emergency medicine physician doing traffic safety research. So if you know anything about the Chevy Corvair and its relationship to traffic safety, well, I think enough said there. If you don't know about that, you should read about that. It's quite interesting. I'd also like to thank here in the beginning a group of just wonderful people over my time that have allowed me to grow and navigate my traffic safety trajectory as well as my public health trajectory over the last 20 plus years. Folks that were really central to my development, like emergency medicine physicians like Ricardo Martinez and Jeff Runge, that were NHTSA administrators, many of his staff, people at UCLA that really prompted me and helped me develop my public health training. My first collaborators at UC Irvine was when I was a young assistant professor, Phyllis Agron, Diane Wynn, Craig Anderson. And my initial beginnings of traffic safety were in the child occupant safety area. Folks like Chris Murphy, who we worked very closely with at that time, that was in the Office of Traffic Safety. And over the last decade and a half, working very closely with people at NIH, collaborators, friends, mentors at both NICHD and the NIAAA. So with that, let me start again and talk a little bit about the beginnings of our year, last year, COVID-19 here at Yale. In fact, today, I think marks the anniversary of our first patient COVID that we had here at Yale. And the onset of illness and disease at that time was fast and furious for sure. We faced an intensive and perpetual change clinically, administratively, and operationally as well. Me and my colleagues and so many people, first responders, EMS, technicians in our emergency department, trying to really understand the scope of the effects of COVID and what that was going to mean for us, even in the early beginnings, in the clinical setting, our immediate communities. Now, as an emergency medicine physician, it was clear, as it is today, our charge and focus remains the same, and that is to save lives and keep others safe. That's what we were charged with, and that's what we continue to do. And that's what we signed up for when we decided to pursue emergency medicine. But we knew within the first few days to week or so that this threat was a little bit different for us. All the same, whether it was me, my colleagues, the nursing staff, our teams, our treatment teams, we were trying to not become victims ourselves so we can continue to help others. And that's really what we try to do right from the get-go. Further, at the front of it all this, we anchored on a key emergency medicine axiom that was originally, really emanated from the beginnings of emergency medicine in the early 1970s. And it goes a little bit like this: no shoes, no shirt, no money, no problem, we're here for you. And I think the rest of the country did see that in our first responders, whether it was in the hospital, outside of the hospital, and we continue to press on, really trying to understand how to keep everybody safe and keep ourselves safe. Initially, when the COVID pandemic started here in our setting, our patient volumes went down for good reason. There was a lot of public health communication going on, asking people to stay at home, trying to minimize exposure to our populations, our communities, et cetera. And shortly thereafter, as we start seeing the first few patients come through our emergency department doors, the acuity rapidly increased. It really went through the roof. And this is understanding that at our institution here at Yale New Haven Hospital, our acuity is already high. We have a 1,000 bed hospital. Before COVID, we were seeing 100,000 visits per year here at Yale New Haven Hospital. And we had a level 1 trauma center, a cardiac center, stroke center, all the rest. And so we had a baseline of high acuity patients altogether to begin with, and this took it even higher for us. Further, at the same time, once again, within the first few days to a week or so, we knew that there was another challenge that was brewing for us. And while we were focused on taking care of people in the acute setting, the complications of COVID disease, and that was the burden on mental health, not only for our patients and our communities, but also for our colleagues, side by side working with everybody day after day. Mental health was certainly being exponentially stretched. The fear, uncertainty, stress, anxiety, thinking, will I take this disease home to my family? Will I take it home to my kids? Will I be taking it home to my parents that may have other significant medical issues? That's the last thing anybody wants to do. So all these things exerting pressure on mental health. And certainly we saw across the country, many reports, of course, of escalating depression, suicidal ideation, suicide, alcohol use disorders, as well as substance use disorders. And so I'm happy to say today that I think we're in a much better state, and I hope this will continue to improve. But at the same time, as a researcher, I was quite intrigued by what was happening as COVID started. And Lorraine just spoke a little bit about this. And we saw that traffic safety, that the landscape was changing. Daily traffic was going down, the number of miles driven were going down, but certainly we also saw that speeding and impaired driving really had no respect for COVID-19. If anything, things worsened, and we're seeing the manifestation of that with these early numbers as well on fatalities. So we had plenty of work to do in this area before COVID-19 started. Now we have more work to do, but we all are going to press on. So what do we do now? From my perspective, I'd like to say, there needs to be a little bit of a relative patience. And this is an active patience. And what I mean by that is we need to actively stay informed about how to continue to keep ourselves safe, keep others safe, keep the lines of communication open when it comes to information, and share that with our neighbors, our friends, workplace, our institutions, so we can continue to move forward and continue to stay safe. There is no silver bullet here. We need more time. And so, a little pun intended, but at the same time, very serious, we do need to buckle up. But this is an active and safe and secure buckling up. As time is passing, so many people are working hard to currently add to the clarity, to the science and the pragmatic and effective implementation in the public space when it comes to COVID-19. All of this, as we full well know, is a perpetual work in process at the research level, the clinical level, public health and public health policy level as well. So with my last slide here, I'd just like to leave you with a couple of thoughts, specifically the traffic safety area. As you can imagine, it's in the areas of the work that I've been doing for some time now. So first of all, I'd say we'd have to certainly stay the course when it comes to making sure that our young novice drivers are prepared for safe driving. This is, I think, the wrong time for us to forgo proper instruction, testing in this area of COVID-19. Obviously, they're at great risk, and this is otherwise a big issue. We need to continue to keep the proper instruction and moving ahead. I think from a state level, there is also this opportunity for us to take advantage to bolster GDL policies. Enhancing safety facets in GDL at the state levels certainly will enhance safety and save more lives. The Insurance Institute for Highway Safety on their website has a real nice GDL calculator where you can manipulate and enhance safety facets state by state of GDL policies and see how many more lives are saved. Further, I think there's an opportunity here to expand GDL potentially to older novice drivers. And finally, I think we need to persist from an innovation standpoint that's both technological as well as behavioral and programmatic, and translate that into programs and implementing those into programs where we can continue to be more aggressive and reduce impaired driving. And this is a clinical piece that will roll into this and need to certainly penetrate all of this. So we can identify individuals that need help, that need treatment for alcohol and substance use disorders, get them the right referrals, get them to treatment, and also keep the public safe as well as our drivers safe. So with that, I thank you very much for allowing me to speak to you today and just share with you some of my reflections.
Thank you, Dr. Vaca. As you noted, speeding and impairment have been exacerbated by the pandemic, but thank you also for noting that we also have unfinished business in other areas like teen driving safety. Next, we have Chief Mike Brown. And Chief Brown has 43 years of public service and nearly 4 decades of experience in law enforcement, safety oversight, and public policy. He was appointed as chief of the Alexandria, Virginia Police Department in January 2017. Since 2010, until his appointment as chief in Alexandria, Brown served as director of the Office of Impaired Driving and Occupant Protection at the National Highway Traffic Safety Administration, where he was responsible for the development and implementation of national traffic safety policy and best practices. During his time in NHTSA, he also served as acting associate administrator for research and program development, Office of Emergency Medical Services, and Office of Defect Investigation, and served on the Lifesavers Planning Committee. Prior to his NHTSA work, Brown rose through the ranks of the California Highway Patrol, starting as an officer in Los Angeles in 1977, culminating in his appointment as commissioner from 2004 to 2008. From 2008 to 2009, Brown served as the deputy secretary for public safety at California's Business, Transportation, and Housing Agency. Brown is an executive fellow at the National Police Foundation and serves on the Law Enforcement Committee of the Transportation Research Board. Additionally, he currently serves as co-chair of the International Association of Chiefs of Police's Research Advisory Committee and is a member of the National Police Foundation's Board of Directors. So please welcome Chief Brown.
Thank you, everyone, for being with us today. And I apologize for not being out there in California and having to do this virtually. Instead, I'm here from Alexandria, Virginia. I got to tell you, this has been a very interesting time during the pandemic. 2020 was incredibly important. And what I want to talk a little bit about today is an extension of what you've heard from your previous speakers. Both Russ, Lorraine, and Dr. Vaca all talked about the impact, for example, on traffic safety as a result of what's happened in 2020. I want to talk a little bit about the issues directly related to law enforcement. And why do I want to talk about that? Well, for decades, we have been using as one of the means to try to promote voluntary compliance is the use of law enforcement out there, one as a deterrent, And then two, as an enforcement model. And it provides the opportunity to track and identify individuals who make bad decisions behind the wheel. And that's a huge issue for us in traffic safety. And it has been for, again, at least my entire career working with traffic safety issues. Now, in 2020, we had a unique experience, something I've never seen in my 45 years of public service. We all faced the issue of a pandemic. This time last year, if you recall, many of us were actually getting almost daily reports with changes in what we know about COVID-19. And yet a number of folks, including medical professionals, firefighters, cops, and others in the private sector were going to work. And employers are trying to keep them safe. And in many cases, we had situations where what we learned in the morning was different in the afternoon. And so the pandemic changed the way law enforcement dealt with traffic safety. Executives across the country in policing started to minimize the exposure to their employees so that they would have a working workforce to be able to respond to larger emergency issues and to provide basic public safety during this unknown period of time. Many of us minimized the exposure by eliminating certain activities, taking minor property crime reports, and yes, trying to preclude people from doing traffic safety enforcement because of the potential of exposure and transmission of COVID-19, especially in the early days when many of us did not have PPE, personal protective equipment, that was available to us. Then we had the shutdowns, where people were being locked down in their homes. Everyone was teleworking. You could actually shoot a cannon down a roadway and not see anybody during that period of time, not hit anybody. And so we had officers that were out there doing work, responding to a different type of reporting police activity. Many of it's involving domestics, a lot of grand theft auto across this country. And as we started to get PPE, we started to emerge and go out and do traffic enforcement. Now, that's not to say we didn't stop an incredibly aggressive high-speed driver or an impaired driver. We did that, but they weren't out there, not in the same level they were before. And then at the end of May, we had an incident in Minneapolis that affected law enforcement as well, kind of like a double hit. We saw the killing of George Floyd. We saw the community uproar of policing, a challenge and a charge for reimagining policing across this country. And indeed, we saw a lot of cops asking the question why they want to do this for a living. So on that journey, we were seeing the light at the end of the tunnel in many areas, but so many issues were raised that you can imagine the importance of what's going through the mind of the officer, the trooper, or the sheriff's deputy that's out there in that patrol car. Fortunately, we've gotten them the PPE they need to do. We are engaged in traffic safety again. We never really lost the people who were, true converts to that mission. But then there's also that question as to whether or not I'm going to expose myself by making a traffic stop when the national narrative on policing and reimagining includes a discussion on traffic. In fact, there's been advocacy of certain policy changes to remove police from traffic. In fact, in Berkeley, California, they're exploring that right now. There are other parts of the country where they're looking at trying to use automated enforcement instead of police officers to do traffic. And that works very well for a variety of violations, but not all of them. Certainly for speed, certainly for red light running and other types of violations, but how about a right-of-way violation? How do you do that? Anyway, this discussion is not over. And the challenge for us as a traffic safety community is how do we get these police officers back in the game? Not the converts. The converts will be there for us. The real question is, how do we get the others back in the game in this environment? Well, that will be a challenge. It's a challenge for every chief and sheriff, commissioner, anyone who's working with their employees to try and reestablish and reaffirm not only that traffic is important, but traffic is important because it saves lives. I used to say, and I still say today, that when you knock on a door in the middle of the night and tell somebody that they lost a loved one, it doesn't matter whether or not they died by knife, bullet, car. Pain in their eyes and the emotions that they're feeling are directly related to the fact they lost somebody. I'm convinced with the support that we can provide to our law enforcement community, with doing the right thing within the law enforcement community, that we can get the law enforcement community back into traffic safety enforcement. And in fact, I think we need to have them. It was a model that works for decades. And quite frankly, a lot of folks have relied on it. But we can't forget that officers have choice and they have discretion in what they do every day. And we have to reassure them of the importance of their role and that we believe in them in order for that traffic law enforcement to continue. Thank you very much for the opportunity to be here. And I look forward to seeing you another time, perhaps not virtually, to discuss this and many other traffic safety issues. Thank you again.
Thank you so much, Chief Brown, and thank you for outlining those big challenges and the importance that our law enforcement community has played in saving lives, and the fact that we need to continue to work through these issues in order to make progress. We're going to use the next few minutes to as discussion and have some questions for our panel. And the first question is for Lorraine. Lorraine, what specific policies does the National Safety Council support to eliminate roadway deaths, to get us closer to zero?
Yeah, well, thank you for that question. And that's what's on all our minds. I mean, we've just heard three stories of, techniques and approaches to helping make sure we don't lose loved ones on the roadways. But it is going to take a variety of actions on our collective behalf to make that happen. Policies are one of them. As I mentioned before, we really see a three-pronged approach to eliminating crashes. The first is doubling down on what works. We know what helps save lives on our roadways. We know it's not speeding. We know it's wearing a seatbelt. We know it's not driving under some influence, and we know it's not driving distracted. We really have to make sure that all of our residents around the nation remember those rules and make sure they do our part. As we heard, volunteer adherence to regulations and policies is the first place to start. We all need to do our part. On top of that, we need to make sure we have good technology in our cars and that we roll out that technology so that we're using it. And then also making sure that we have a safe streets, safe culture, and safe systems. There are a lot of things we can do with policies. We can do things around lowering the blood alcohol level in each of the states to 0.05. Utah has done that. We'd love to see some more folks do that. We'd also love to see a speed limit staying at least where they are. And in some cases, cities have done some great work to reducing speed limits in some of their cities and truly changing the dynamic on the roads. Also looking for automated enforcement. Thank you, Chief, for bringing that up. The National Safety Council has seen that in many communities be very effective when it's used for safety and not for other reasons. We actually have a checklist that we can provide folks that help you if you're thinking about doing automated enforcement for, as we heard, speeding and or traffic light enforcement. And it really does save lives. The data shows it, but it has to be done right, and it has to be done in a way that the community that is getting that technology understands what it's for. It also can be something that can help us with equity issues, as long as, again, we're putting it at the places we know are the intersections that are the deaths and injury statistics that are at the higher end, not just in a community because that's a place we go like to get tickets. So really important that it's done right. We also know that there are some policies around use of cell phones and making that, a primary enforcement for distracted driving and upgrading enforcement, as I said, on a lot of these things to primary enforcement. No behavior changes for us unless we're looking at all three parts of what it takes. And that includes enforcement, as we just heard. That includes educating and making folks understand what safe behavior is and what they can do to be part of it. And then in some cases, legislation. So we really think policies across all three of those and resources to help us all know what safe looks like, and then ensuring each of us is doing our part.
Thank you, Lorraine. And automated enforcement is so important. And as you point out, we do need to, be transparent and be open with the public and bring them along with us and do it right. The next question is for Dr. Vaca. As a traffic safety professional, and more specifically from a traffic safety public health perspective, what have you seen or experienced during the pandemic that has come to bear on health disparities? And do you have concerns about such disparities, getting worse in the future?
Yeah, thank you, Russ. This is quite a complex question. At the same time, as we've already heard from the other speakers, is that and myself, is that we still have this massive issue of alcohol, drug impaired driving that we had before COVID. That certainly COVID has exacerbated much of that because of a lot of mental health related issues. And so we still, even aside from COVID, the medical community struggles with trying to get patients into the right places, get the right care, even the screening pieces, which I think we're much better at and become much better at over the last decade and a half to 2 decades. But once you screen, the next piece is to get people to the right places for the proper specialized treatment services, and thereafter, maintaining those services in place for other people and for people to stay to improve their mental health. It's all intimately tied because these are the same people that are working day to day, that are on the highways, on the roadways, right next to you and me as we're driving down the roadway. And we want to really, keep our roadways safe for pedestrians, for cyclists, of course, for drivers, whether you're, in a big truck, carrying freight, or, a passenger vehicle. So from that perspective, we know that there are alcohol, substance abuse related health disparities. We need to continue to target that and work at that. There's a lot of great work going on across the country, many institutions looking at disparities, differences, but also looking at treatment, options for treatment. Here at Yale, I have a group of colleagues who have been working extensively throughout the country, even starting to initiate treatment within the emergency department, an emergency department visit, both from a behavioral perspective in interventions, as well as starting pharmacological therapy in the emergency department, just for an emergency department visit, and then connecting them for treatment services. So while it's a considerable issue, we need to kind of forge ahead and keep staying innovative, developing, growing others that will come alongside us to help us in this area.
Thank you so much for that, Dr. Vaca. I want to direct a question to Chief Brown. Mike, you touched on this in your presentation, pointing out how important, what an important role law enforcement has played in traffic safety. How do you think we should work through the issues that have been discussed surrounding the defund the police movement?
Well, Russ, that's a great question and very timely. The defunding the police movement is a statement talking about asking for change in policing, and the police agencies across the country have seen that, they've heard that, and many are making changes, or have already made changes to accommodate what the community need is. the defund issue itself is taken on a new dynamic in state and local government in particular, and largely because of COVID. We're hoping that the stimulus package that's been recently passed will help us in terms at the local level fill in the holes in our budgets that need to be addressed. Some communities are better positioned on that issue than others. But the dialogue about defunding the police on top of the dialogue of lack of shortage of revenue to support local and state budgets just exacerbates that whole issue for policing. Now, there are police departments that are worried about whether or not they'll be able to retain people. They're certainly worried about whether or not they'll be able to fill vacancies. They're worried about whether or not they're going to have the basic equipment in some cases to staff and put their people, equip them properly to go out and do the things they need to do to protect the public, provide public safety in their community. And part of that equation is the efforts and the willingness and the ability to do traffic law enforcement, because traffic law enforcement costs. An automated speed enforcement program has with it attendant costs in the back end in particular to evaluate before you prosecute a case. If you're doing an investigation, trying to fill out a FARS report that's going to go before, that requires staffing to do that. In some cases, forensics information, medical examiner pieces. There's so many things that are wrapped up in this. So defunding itself, in the context that it was first offered, is owned by the police department and policing in terms of making sure we do what the community wants us to do. And I'm convinced that this profession will survive this and will come out better. I've been through this about 4 times in my career at different locations, even in California. And we have emerged better, more professional, and in many cases, we've earned back whatever trust we lost or questions in our communities. But the other piece is a piece we can't control. And it affects not only the police department, it affects others. And so administrators and city managers and councils and board of supervisors at the local level across this country are making some very tough decisions right now, getting ready for the next budget cycle. And part of that involves funding police. So this will be an interesting year to see how it unfolds. And I hope and pray that of all the things that may appear on the budget director's radar, that traffic safety is not one of them.
Thank you, Mike. A lot to think about. And we have a couple of minutes left in this segment. I don't know if Dr. Vaca or Lorraine Martin have any thoughts on this or other issues we've talked about.
I would just like to connect the dots on the incredible stress that a lot of our community members, residents, family members are under. And we heard from Dr. Vaca the mental health stress, folks having substance use issues. Those all get intertangled with driving safely, because those folks unfortunately have to get somewhere and they may get in their car and they may not be on par. So I just think it's really important for us to extend our overall understanding what impairment means and whether or not someone is fit to do something that could have safety sensitive ramifications for themselves or other, either at work or on the road. And understanding that impairment is not just that you are drunk from alcohol. It could be a variety of things, including mental stress, and just not being situational aware with everything going on. And we all need to have a heightened awareness of the folks around us and whether or not they can do safely what they're about to do, and what our role is in helping them perhaps prevent putting themselves or others at risk, no matter what the impairment cause might be.
Thank you, Lorraine. Well, I'd like to once again thank our panel, Lorraine Martin from the National Safety Council, Dr. Federico Vaca, and Chief Michael Brown for sharing their insights with us. This was really an interesting discussion. I'm sure we've all identified takeaways that we can bring back to our agencies, and I'm looking forward to continuing this discussion during our workshops and peer discussions over the next 2.5 days. So thank you very much to our panel. Great job. As I mentioned earlier, crashes and risky driving are on the rise as a result of the pandemic. Incidents involving vulnerable road users have also been trending up even prior to the pandemic. And the rise of these risky driving behaviors puts all road users at risk. But pedestrians, cyclists, and motorcyclists are particularly vulnerable. Every year, we recognize the human tragedy and toll that traffic crashes have on our families, communities, and nation. And it's why we're here, to prevent these events from happening and learn from them when they do. Our final speaker and her mission is a testament to this cause. On October 8th, 2013, Amy Cohen's 12-year-old son, Sammy, was killed as he was heading to soccer practice across the street from his home. Amy joined with others and co-founded Families for Safer Streets. Families for Safer Streets confronts traffic violence by advocating for life-saving changes and providing support to those personally affected by crashes in our communities. All of its members have been either injured or lost loved ones in this preventable public health crisis. This burgeoning national movement started in New York City, where Amy and the founding chapter worked very closely with New York City's DOT Vision Zero and had numerous legislative successes, including lowering the speed limit, getting the nation's largest speed safety camera program put in place, passing legislation implementing a master plan, redesigning streets, and more. And these victories prompted others across the country to also start chapters in their community, elevating the demands for local, statewide, and national legislative policy changes. So join me in welcoming Amy Cohen. Amy?
Thank you, Russ. I'm so honored to be here today to give a face to the statistics. 40,000 Americans die on our roadways every year. You hear a lot about the statistics and numbers at Lifesavers, but today I want to remind each and every one of you, behind every number, there is a life, a devastated family, and a heartbroken community. It is 2,711 days since Sammy died. 2,711 painful days since I last kissed him goodbye, touched his face, smelled his unique Sammy smell, saw him chatting with his sister, made him breakfast, and gave him a hug. Every parent thinks their child is special, but Sammy really was amazing. He was curious about the world. He loved to ask questions, carefully pondered the answers, and then seemed to always have an unquenchable desire to know more. He was a budding Renaissance man and excelled in sports with fierce determination. He played soccer, baseball, and hockey. And just weeks before he died, he rode his bike with my husband, Gary, in the New York City Century Ride. And at 12 years of age, he was the youngest one to complete the 100-mile ride. Gary called me that day from a rest break at the 85-mile marker. He said that Sammy was exhausted, so they'd be stopping early and heading home. But somehow, Sammy mustered the strength to get back on his bike and ride for the final, most hilly portion of the course. I thought my love was so strong that I could create an invisible shield around my children. Sammy was smart, street savvy, and didn't take risks. We lived in a safe residential neighborhood where children played on the side streets, though I never allowed mine to do so. But every year, thousands of parents like me learn that their shield is fallible, that our roadways are deadly. My husband had said to me just days after Sammy died, if only we were living in London, Sammy would still be alive. We had just gone there a few weeks before on vacation, and London had just adopted Vision Zero, lowered their speed limit, and had signs posted everywhere that 20 is plenty. On our final day in London, Gary took Sammy to a professional soccer game and a stadium tour. He said it was the happiest day of his life. I never imagined that Sammy would have so few days to live after that. After he died, I was so full of pain, and it had to go somewhere or it would consume me. So I started speaking out, and soon I joined with others and helped form Families for Safe Streets with the help of transportation alternatives. As Russ mentioned, our mission is to confront the preventable epidemic of traffic violence. We chose the word confront and the word epidemic very intentionally, because just like with COVID-19, traffic crashes are preventable and we have the tools to prevent it. But somehow we still call them accidents, as if there is nothing we can do. We share our stories to push back on this complacency. Our collective stories are powerful. We started with a few dozen members in New York City and now have a dozen chapters and more in formation. We share our tears and we are making waves, from demanding action at vigils to holding lobby days at our city halls and capitals. We seek not just to raise awareness, because we will never be able to educate our way out of this problem. We demand legislative and policy change to redesign our streets, lower speed limits, and use automated enforcement to change behavior. We advocate to get dangerous drivers off the road, support crash victims, and so much more. We start with a single premise: zero is possible, and it is the only morally acceptable goal. No loss of life in a preventable crash is justifiable. Thank you for all you do. And today, I ask for one more thing. Please help us elevate the heartbroken voices in your community. Give those who've been personally impacted the platform, skills, resources, and opportunities to have their voices heard, so that one day there will be no need for a Lifesavers roadway safety conference. I always find it's best to hear from our members directly and to see them in action. Today, I want to share a video, not just about our unrelenting work in New York, but from Families for Safe Streets chapters across the country, so that you can see the power and potential of our growing movement in action. Please also visit Families for Safe Streets YouTube channel and use our compelling stories. Before we show the video, I just want to thank you all once again and invite you to reach out and support our fight. Members were killed because New York City's transportation policies have prioritized the swift movement of cars, trucks, and buses. Today, we are announcing the creation of Families for Safe Streets to advocate for policies that will prevent others from being killed or maimed by reckless driving in dangerous conditions. We came together, several of us met after our children and family members were killed. We're the group nobody should ever have to join.
Families for Safe Streets saw a real change early on in 2014 when we changed the speed limit from 30 to 25.
This bill is now law.
Starting the chapter DC Families for Safe Streets, we've learned the power of our voices and our stories. So this is my cousin Jamie. She's right here in the middle. Our families were immigrants to the United States, and our parents had settled in neighborhoods near each other, and so we would hang out all the time. She passed away when she was 24, and quite frankly, it's just been difficult to see the impacts of her death.
What brought me to work as an advocate for Family for Safe Streets is not a good reason, but we had lost our family members in a traffic crash. I just thought that, I know they did not die in vain, and that some work had to be done.
My nephew was hit by a driver driving a pickup truck, and it incapacitated him. My complete lack of being able to feel like I could do anything and the anger that I had drove me to really advocate more for safe streets.
I became involved when my father was struck by a speeding driver right near where I grew up in Brooklyn. In that split second, almost took my father's life. Now I'm involved with starting the Families for Safe Streets Nashville chapter.
How I got started in this work was nothing that I really anticipated. But on October 19th, 2010, my son, Connor Lynch, who was a junior in high school, he was crossing the street for cross-country training, and he was hit and killed by a distracted, hit-and-run, non-licensed driver. And at that point, obviously, my entire life changed. And of course, through the grieving process, I just wanted to do something.
Being able to connect with other families that have dealt with this has really been life-changing, because you know that there's other people who are going through what you're dealing with. Even if the crash was a different type of circumstance, the loss and the pain and the trauma is the same. And that feeling of why wasn't this prevented is still there. And we can connect over that.
For these cross-country support meetings, people have found each other and are able to talk honestly about what they're experiencing, whether they're small triumphs or some small setbacks, but it's been helpful for people to relate with one another.
We really need to come together and demand traffic safety measures to prevent deaths.
You can tell your story of what happened to you or your loved one and your family. Your tragedy is not just your personal tragedy, but it's the tragedy of our community, of our neighborhood, of our city. And it's just one example of a larger pattern that needs to be addressed by the people that have the power to change it.
We need smart ideas, which we have. We have amazing advocacy groups working on this every day, but we also need the passion of people who can really speak to the importance from a personal level. And that's where we've seen the change. You know, when we see members of Families for Safe Streets speak at a hearing about a change on the streets, or show up at a memorial and speak directly to the news media or state legislators about policy change and needs, when we see them organize letter writing campaigns or march on the streets to demand that their kids can get to school safely, can play in a park safely, we know that we need that kind of activism. We know that we need people who really can speak from the heart. And I don't think we're going to make the change we need. I don't think we're going to reach Vision Zero without lifting up the powerful voices of Families for Safe Streets and really investing in their voices being heard, in making sure that they can be strong, powerful advocates and fight for a better tomorrow.
Amy, as you said, we have the tools. We need to reach into our toolboxes and use them. We are so sorry for your loss, but we all thank you for your leadership, your passion, and your dedication to honoring Sammy's memory through this important and impactful work. As we aim for a future with safer roads and stronger communities, we look to our youth, those who will take our place to strive for a better and safer world to come. And I'm pleased to announce that today we have 48 bright young traffic safety professionals joining our efforts. I'd like to acknowledge the 2021 Lifesavers Traffic Safety Scholars. Their names and schools are listed on the website and on the lobby of the virtual platform. This evening, the scholars will learn about traffic safety career opportunities from a panel of young professionals. A virtual networking event with leaders from federal and state government agencies and NGOs was held prior to the conference. And I have had the pleasure of meeting with these undergraduate and graduate students, and I am excited about this new generation of safety professionals. The scholars are available for networking opportunities. They may be reaching out to you through the networking features available during the conference, so please be ready to share your knowledge and expertise with them. I also encourage you to reach out to them. We are excited about what we can do together to ensure a better future for them, for our children and generations to come. For those students who are participating in this year's conference that have not applied to be a Lifesavers Traffic Scholar, I encourage you to apply next year. Next, if you have not already done so, please familiarize yourself with the virtual platform, which includes a resources lobby, exhibit hall, plenary theater, workshop hall, workshop networking lounge, and help desk. It has a lot to offer, including access to the complete conference program, workshop grid, chat, and search features, plus plenty of networking opportunities. The lobby will provide you with access to valuable resources such as the Lifesavers Planning Committee list, traffic safety scholars information, peer exchange, session details, and networking session information. Upon entering the virtual site for the first time, a welcome video from our official 2021 Lifesavers Ambassador, Jamie Garza of the California DMV, will pop up to greet attendees. Similarly, brief tutorial videos will open upon entering each virtual room to help with the acclimation process and explain special features. Lastly, we urge you to take the opportunity to evaluate the workshops by completing the survey found in each individual workshop's console. Your feedback guides the planning process, so please take a moment after each workshop to attend to provide feedback. Finally, whether you are new or returning Lifesavers participant, we're glad you're virtually here, and we hope you enjoy what we've put together for you. I encourage you to join with the planning committee listed in the lobby section of this website and share your experiences on social media using hashtag Lifesavers2021. The first workshop begins promptly at 1 o'clock Eastern time in just 15 minutes. So thank you for your attention, and please enjoy the conference.